Hi guys, my name is David, and we're gonna go over the anatomy of the knee, thigh, hip, and the pelvis. This is Martha and then Melanie as well. So we're gonna start off with the bones of each section. First, we have the hip. So this is subdivided into three sections: the hip bone, the sacrum, and the coccyx. The hip bone would be on the lateral ends. You have your sacrum in the center, and then you have the coccyx at the bottom, which would be your tailbone. Going over the bony landmarks of the hip, you do have the iliac crest, which is on the outer ridges at the top. So it's the highest point of the pelvis. It goes from the anterior and posterior ends. You also have your anterior and posterior suprailiac spine, which would be the front and then the back of the hip uh, on the iliac crest. You also have your ischial tuberosity, which is at the very bottom over here, close to your glutes, and it folds posteriorly. And then, of course, you have your symphysis pubis, which is the hard bony provenance that you feel when you palpate down from the abs. So here you see the the ischial tuberosities, which is at the bottom again, close to the glute area. And then, of course, you do have the anterior and posterior iliac spine. So now we have the landmarks of the pelvis. Again, your iliac crest, your anterior and your posterior superior iliac spine, which would be the front and the back again. And then, of course, we do have structures of the hip bone, which is subdivided into three sections. You have the ilium at the top, it's the upper portion of the hip bone. And then you have your pubis, which would be in front of the hip. So it's closest to your genitals. And then you have the ischium, which is at the very bottom behind the pubis.
Okay, and then for when this is the femur, and so for the femur landmarks, we have the head of the femur that goes into your hip right there, into the pelvis, and the neck coming out of that. That's the projection coming out of the femur right there, and then the trochanter is on that same side, and it's a good palpation point when you're next to the hip. And then the lesser trochanter on the opposite side, on the posterior side over there. And then the linea aspera is also on that posterior side. If you go to the next slide, it goes straight across the shaft right there. And also on the side, you can see the medial epicondyle, that ridgy area on that left side right there, or on that left picture. And oh, and the medial condyle is that notch on the opposite side right there on the posterior side. And then the lateral epicondyle is the rigid area on the anterior view. And then the lateral condyle is that notch on the opposite side there.
All right, so the bones of the knees, we have the femur, the one that Martha was just talking about right now, patella, fibula, and tibia, and all of these are connect to the bone, or to the knee, sorry.
Okay, so now we're going over the joints of the pelvis bone. We have the sacrococcygeal, which is right close to the tailbone. It's a little bit above it. It's located between the apex of the sacrum and the base of the coccyx again, which is the tailbone. You have your lumbosacral, which is between the last lumbar vertebrae and the first sacral segment of the vertebral column. Then you have your pubic symphysis, which is between the main body of the pubic bone, right in the middle. And then, of course, you do have your sacroiliac, which is on your lateral edges of your lower back, so the left and right side, which would connect your lower body to the upper extremity and the trunk of your body. So here we can see a visual image of the lumbosacral joint. Then you have your sacroiliac joint, on each ends of your pelvis, your bones, sorry. And then we also have the coxofemoral hip joint, which connects the femur, the leg, your leg to your pelvis, which then connects to the upper extremities of your body and your trunk. Then, of course, we do have the degrees of motion. So in terms of abduction away from the body would be 0 to 45 degrees, adduction towards the center, 45 to 0 degrees, extension, 115 to 0, internal rotation, 0 to 35, so rotating inward, and then externally outward would be 0 to 45 degrees. And then, of course, we do have some visual images so you can see exactly what direction it is.
All right, so for the knee joint, we have the patellofemoral, which is behind your patella and where your femur meet at the front of your knee. And it's pretty much involved by climbing, walking on an incline, and several other knee movements as well. And then we have the tibiofemoral joint. It allows 2 degrees of freedom, flexion, extension, and internal and external rotation. For the flexion, we have up to 140 degrees, and the extension is up to -5 degrees.
Okay, so now we're going to go over ligaments, starting with the hip bone, where we're going to go into capsular. So we have 3 categories: your iliofemoral, which you can see right here in the pink area. It limits extension and external rotation of the hip. You do have a certain range that you can't go outside of if you're functioning properly. And then you have the pubifemoral, which would be over here in the yellow area. It limits hip abduction, so movement outward, and then extension. And then last but not least, we do have ischiofemoral, which limits internal rotation, movement inward, and then hip abduction, so your hip moving towards your center. And then this would be right here in the blue area, as you can see. Now we have the ligaments of the hip and the thigh. So both of these are connected, they go hand in hand. Your IT band, your iliotibial band. The origin would be iliac crest, your gluteus maximus, your tensor fasciae latae muscles. And then it inserts at the tubercle of the IT tract, which is also known as Gerdy's tubercle. The function would be stabilization laterally of the hip and the knee.
And for the ligaments of the knee, we have the ACL, which limits rotation and anterior movement of the tibia. PCL, posterior, limits posterior movement of the tibia. MCL limits valgus stress, and the LCL limits varus stress. And then here are more pictures of the ligaments as well and the movements.
Okay, so now we're going to go to our next category, which would be muscles of each group. So now we have the hip and the pelvis muscles. First, we're going to go into the iliopsis, which you can see right here in the green area surrounding your spine, connecting to your pelvis. It originates in the iliacus at the iliac fossa. We do have like the exact location in terms of the spine, T12 to L4. And then, of course, it inserts at the lesser trochanter of the femur. And then the function would be thigh flexion. And then also in the trunk and the vertebral column as well. Now we have another pelvis muscle, which would be piriformis muscle. It's right here connecting to the center of your pelvis. Origin would be anterior sacrum and sacroiliac joint. It inserts at the greater trochanter of the femur, and then the function would be rotating outward externally, and then abduction, movement away from your body. Of course, now we go into the superficial hip muscles, superficial being the surface muscles. We're not going too deep into detail of deeper muscles. We have the hip and the pelvic muscles. First, we're going to go over the gluteus maximus, which you can see right here. It's the very bottom portion of your glutes. Origin would be lateral posterior surface of the sacrum and the coccyx, gluteal surface of the ilium, thoracolumbar fascia, sacrotuberous ligament, and then the insertion would be the IT tract, and the gluteal tuberosity of the femur. Of course, the function is extending your thigh, and then externally rotating your thigh as well. Next, we're going to go over the second muscle of the glutes, which is the gluteus medius, which is a little bit above the maximus. Its origin would be the gluteal surface of the ilium. Insertion would be lateral aspect of the greater trochanter femur. And then, of course, function in terms of the hip, it would be thigh abduction, moving away from your body, anterior thigh, internal rotation. So at the surface of your thigh, rotating inward. And then, of course, you have stabilization of the pelvis, which stabilizes your trunk and upper extremities. Next, we do have the hip and the pelvic muscle. We're going to go into the adductor magnus muscle, which is the inside of your leg. The origin would be inferior pubic ramus ischial tuberosity as well. The insertion would be linea aspera, and then the adductor tubercle of the femur. The function would be, again, in the name adduction, so of the thigh, so you're moving inward towards your body, and then internal rotation, rotating inward, and then, of course, flexion as well.
And then going into the thigh muscles, it's divided into three main compartments: the anterior compartment, posterior compartment, and medial compartment. The anterior compartment is those quadricep muscles, the rectus femoris, vastus medialis, vastus intermedialis, and vastus lateralis. And then the sartorius that comes right across those. And then the posterior compartment contains the biceps femoris, the semitendinosus, and the semimembranosus. And then in the medial compartment there is the adductor brevis, adductor longus, and adductor magnus, and then the pectineus and the gracilis. So in the anterior compartment, so first looking at the vastus medialis, the origin is the whole length of the linea aspera that we're looking at on the femur there, and then the medial condyle ridge. And then the insertion is the medial half of the upper border of the patella and patellar tendon to the tibial tuberosity. And the action of is the extension of the knee, and actually all but the rectus femoris, these quadricep muscles are all going to be extension of the knee. So the vastus lateralis, the origin is the anterior and inferior borders of the greater trochanter of the femur, and then the insertion is the lateral border of patella and patellar tendon to tibial tuberosity, and the action extension of the knee. And then lastly, there vastus intermedialis is actually right under the rectus femoris. So the origin of the vastus medialis is the upper 2/3 of the anterior surface of the femur. And the insertion is the upper border of the patella and patellar tendon to tibial tuberosity as well, with the action being extension of the knee. And then the rectus femoris above that one is the origin is the anterior inferior iliac spine, and the insertion is the superior aspect of the patella and patellar tendon to tibial tuberosity as well. And the function of that one is flexion of the hip and extension of the knee. And then the sartorius is that small muscle that goes right across those quadriceps. The origin of that one is the anterior superior iliac spine, and the notch just below the spine of the ilium. And then it inserts on the superior aspect of the patella and the patellar tendon to the tibial tuberosity as well. And then the action of that one, this one does a little bit more. So it does flexion of the hip and knee, external rotation, externally rotating the thigh as it flexes the hip and knee, and then abduction of the hip, so going away from the body, and anterior pelvic rotation. And looking at that medial compartment, the gracilis, oh my God, hold on, cut. How did I say that one?
Gracilis.
Gracilis, yeah, okay, thank you. Okay, so gracilis, the insertion of the gracilis is the anterior medial surface of tibia below the condyle, and the origin is the anterior medial edge of descending ramus of the pubis. The action of that one is adduction and internal rotation of the hip, and it assists with the flexion of the hip. And then the tensor fasciae latae, the origin of that one is the anterior iliac crest and surface of the ilium just below the crest. And then it inserts 1/4 the way down the thigh into the iliotibial, the IT tract, which in turn inserts onto the anterolateral tibial condyle. And the function of that one is abduction of the hip, flexion of the hip, and anterior pelvic rotation. And then it has a tendency to rotate the hip internally as it flexes. And then looking at the posterior compartment, the semitendinosus, the origin of that one is the ischial tuberosity, and it inserts on the proximal end of the tibia below the medial condyle on the inside of the knee there. And then the action of that one is hip extension and knee flexion. And then the semimembranosus on the inside there. The origin of that one is also the ischial tuberosity, and then it inserts on the medial condyle of the tibia. And the action of that is hip extension and knee flexion. And then biceps femoris, that goes right above that one or right over it. The origin is also ischial tuberosity, but also the sacrotuberous ligament, and it inserts on the head of the fibula. And then the action of this one is hip extension and knee flexion.
So now we're going to go over other soft tissue, starting with the hip. So first we have bursa, which is a fluid-filled sac. One bursa that we're going to go over would be towards the groin area of the hip, which would be right here, as you can see in purple, the iliopsis bursa. And then of course we do have the greater trochanteric bursa, which is located on the outside where your hip is. It covers the bony point of the hip bone. Now we do want to go over our soft tissues in terms of fascia. We have the tensor fascia lata, which is on the outside in yellow of the hip. And then you have your IT tract, your iliotibial tract, which is right below in the green. The location would be between the deep superficial and deep fibers of the iliotibial band for tensor fascia latae. And then it is a really small muscle which helps with hip and pelvis stability.
All right, and some soft tissue of the knee, we have the bursa as well, as David was mentioning, a fluid sac that works as cushion and as a gliding surface to reduce that friction between tissues of the body. And it's mostly like located next to tendons near large joints like your shoulders, elbows, hips, and your knees. And on the knee, we have the suprapatellar bursa right up here, the prepatellar bursa in the middle, and the infrapatellar bursa at the bottom. All right, and we have here the bursitis, also known as the pes anserine. So pretty much the bursa becomes irritated right there where it's red, and it produces way too much fluid, which causes it to swell up and put that pressure on the adjacent part of the knee. And we have the Gertie's tubercle. The insertion site of the IT band is located 2 to 3 centimeters lateral to the tibial tubercle on the proximal tibia. All right, and we have the lateral and the medial meniscus. So the lateral wedges of fibrocartilage that sit between the femur and the tibia. And for the medial meniscus gives a little extra stability that provides lubrication and absorbs shock within the knee.
Okay, so now we're gonna go over the neurovascular structures, starting with the hip, the innervation. So first we have the femoral, as you can see right here at the top, femoral nerve. The exact location would be L2 to L4 in terms of like the spine. It extends from the lower border between the psoas and the iliac muscles, and then it goes passing beneath the inguinal ligament. And then we have the arbitrator, which is right below the arbitrator nerve. It goes from L2 to 4, and it travels along the medial border of the iliopsoas muscle. It also goes through the arbitrator foramen with the arbitrator artery and vein into the thigh. So going all the way down in the center. And of course you have the sciatic nerve. It goes from your lower back through your hips and then your butt and down each side of your leg, as you can see right here. So there should be one on the opposite side as well. You have your superior gluteal, so at the top, located in the lower pelvis, and then it goes from the dorsal divisions of L4, L5, and S1 nerve roots of the sacral plexus. And then here again is another visual representation. You can see the 3 different nerves.
And here's the neurovascular structure of the knee. We have the arteries right here with red little stars, and the nerves with the yellow stars that go through the knee. That's it.